Our union petitioned the Occupational Safety and Health Administration to issue an emergency temporary standard to protect us during this pandemic 7 weeks ago. OSHA has not even bothered to respond. Nurses across the country have also been demanding that President Trump and Congress scale up production of personal protective equipment and to get us the PPE that we need. Yet Congress has now passed 3 coronavirus bills, and none of them have anything to protect us. In the richest nation on the face of the earth, the White House, Congress, the CDC, OSHA, and the hospital industry have condemned nurses to death and illness. In my hospital just this week, a couple was admitted. One tested positive and was placed on a COVID unit. The other was asymptomatic and placed in a different unit in a double room. But the asymptomatic patient later tested positive, and in the interim had infected the patient's hospital roommate and had exposed a pregnant nurse and others who were not wearing the proper PPE. Incidents like this are happening across the country. Too often, they lead to preventable death. Like last week when one of my registered nurse colleagues at our hospital died from COVID-19. And our colleague Noel Sinkiat, another DC registered nurse at a different hospital, also died from COVID-19. Our hearts are with the families and co-workers of those nurses and other healthcare workers who have gotten sick from this virus and those who have died. Today, we honor them by fighting to protect nurses and to prevent any more unnecessary deaths. We need to stop the spread of this virus. And to do that, nurses and other healthcare workers need the optimal personal protective equipment to do their jobs safely. We need Congress and the White House to act now and mandate that the Federal Occupational Safety and Health Administration issue an emergency temporary standard to protect healthcare workers and other frontline workers from COVID-19. It is inexcusable that Congress is debating a new COVID-19 interim package without including a mandatory OSHA standard for healthcare workers in the bill. So far, President Trump has failed to use his authority as president to require the mass production of PPE for healthcare workers and other workers. We need President Trump to immediately and fully invoke the Defense Production Act to order manufacturers to urgently increase production of respirators, face shields, coveralls, gowns, gloves, and testing equipment and supplies. Congress should not approve any new COVID-19 legislation without including a mandate for the president to fully invoke the Defense Production Act to mass produce the personal protective equipment and other supplies needed. Nurses are raising our voices across the country, and we demand to be heard. President Trump, Congress, and all other government officials, we demand that you immediately get PPE to nurses, doctors, and healthcare workers on the front lines of this pandemic. If you don't protect us, we can't protect our patients. I would now like to call on my registered nurse colleague, Melody Jones, to read the names of nurses across the country who have died from this COVID-19 virus.
Your name, ma'am?
Erica Jones.
Down, please. Down, down.
Yeah, please. Okay.
Good
Yes.
morning. This morning, we remember the thousands of nurses and other healthcare workers who have become infected with COVID-19 and those who have died. We are demanding that the Trump administration and the U.S. Congress listen to these names, all dedicated nurses who have left families, friends, and colleagues behind. Listen to their names and take action so more nurses don't get sick and die. Please understand that this is just a partial list of those nurses who have died, as these are the names that have been brought to our attention. We honor these nurses by our action here today. Judy Wilson Griffin from St. Louis, Missouri. Kias Kelly, New York, New York. Noel Sinkat, Washington, D.C. Araceli Buendia Iligan, Miami, Florida. Cynthia Mendoza, Norfolk, Virginia. Frida O'Kran, New York, New York. Rosary Castro Aliga, Los Angeles, California. Kevin Garani, Union City, New Jersey. Lisa Ewald, Detroit, Michigan. Raul Diela Asalo, Westland, Michigan. Jeff Bombach, Stockton, California. Larice Anderson, New Orleans, Louisiana. Davina Akkad, Detroit, Michigan. John Abruzzo, Long Island, New York. James House, Detroit, Michigan. Dorothy Jean Bowles, Greenwood, Mississippi. Sonia Roman, San Juan, Puerto Rico. Elizabeth Del Mundo, Caldwell, New Jersey. Angeline Bernardo, Milford, Connecticut. Daisy Doronila, Kearney, New Jersey. Patrick Kane, Flint, Michigan. Ya Asante, New York, New York. Angela Lewis, New York, New York. Edwin Montanano, Kearney, New Jersey. Rose Harrison, Hamilton, Alabama. Earl Bailey, Fort Lauderdale, Florida. Vienna Thompson, Reno, Nevada. Aliyama John, New York, New York. Ali Dennis Guillermo, Passaggi, New York. Susan Siscongo, New York, New York. Rosemary Kupso, New York, New York. Paul Anthony Kamage, Covina, California. Mary Ellen Porter, New York, New York. Maria Cryer, Littleton, Massachusetts. Queen Otto, Randallstown, Maryland. Evelyn Caro, Silver Spring, Maryland. Rose Haldon, Boston, Massachusetts. Danielle DeCenso, Hialeah, Florida. Jennifer Anderson, Baldwin, Missouri. Jacqueline Rowe, New York, New York. Teresa Lococo, New York, New York. Helen Gabati, Washington, D.C. Mike Marteau, Shreveport, Louisiana. Ezekiel Cicerno, Medical Lake, Washington. Let us remember and honor the ultimate sacrifice these nurses paid, mourn their passing, and recommit ourselves to fight like hell for the living. Thank you.
Take a couple of questions if you want to do it as a group. Anyone have a question?
Go. Vic, what's going on, Pete?
No, you can do individual ones after we're done.
Melody Jones, M-E-L-O-D-Y, Jones, J-O-N-E-S. National Nurses United.
So what are the main problems you're finding while dealing with the COVID and in the hospital? What are the main?
Providing the proper PPE. It's not getting distributed equally throughout the hospital. And it's not consistent throughout the hospital for the nurses.
Okay, guys, so we'll just set up over here, and then one by one, if you want to do individual one-on-one interviews, we can do that, but we just have to line up.
Problema.
All right, thank you all. Thank you, nurses.
Wenn du Leute interviewst, kriegt das mit, weil das Mikro da drin ist. Es gibt zwar keinen Ton, aber ich kann
Ja, genau, mach das. Ich würde den einen Mann aufnehmen, ich würde gerne einen Mann einstellen.
Okay, ich würde
Der
sagen,
hat heute alle gesagt, dass den Mann
Hey Lisa, that's it. That's literally it. I'll hold on.
Hey guys, can you actually you need to back up.
I gotta reconfigure. I gotta redo for Hotspot. I mean, I can, the only thing is I've got the camera mic here. If it works out on a camera mic, that's fine. But other than that, I gotta go.
It's over now. I'm just gonna go ahead and exactly up.
Okay, right now what it is they're standing here and they're making you can walk up to individual nurses and talk with them. That's what it is. I mean, I could walk up, but Yeah, I could try. I mean, I don't know what it's going to sound like. I mean, and okay. And I don't have a producer here, so I'm going to have to make
I'll try there. Let's do that. We have 15 minutes, so maybe in 5 minutes we'll move over. I'll meet y'all. I will dial on my phone. I'll dial it next to you. But let's just move over on that little corner there so we can see into there.
Okay, do you want me to just stand here or just walk through the crowd?